Hi everyone, welcome again to another VITA Academy webinar. Today we have Mr. Peter Peasy. Hi Peter, how you doing out there?
Good morning, Mr. Jim, good to see you. It's early for you, a little later for me.
All right, excellent. So today we're going to go over with Peter. Peter's been gracious enough to share his wisdom as always. Another topic, Zirconia Anterior Challenge, characterizing with natural results. Peter, as always, we kind of take a topic and then we kind of expand on that. Peter has all sorts of different ideas, ways that you can help yourself in the lab, what to look for, how to choose the materials, things of that nature. So we look forward to hearing from you, Peter, on this subject, which seems to be everywhere. Zirconia is everywhere.
Very true.
So before we get going, just a couple housekeeping items for everyone. You are on mute. So if you want to have a question answered by Peter, go ahead and use that question box. And at the end of the program, we will have a Q&A. That seems to work pretty good. We are going to do a recording of this webinar. So we post these programs, these webinars, so that you can go back and review on our VITA North America YouTube channel. So give us a couple of days. Today's Tuesday, so it might be posted by Thursday or Friday this week. And then those of you that are going to ask about CE, I'll remind you at the end as well. CE on your, when you registered, if you provided the information for your CE, we will go ahead and forward that to the correct MBC or Florida Dental Lab and so forth, the CE broker down in Florida or Texas or whatever state it may be, or specific to what you requested on your registration. So Peter Peasy, again, has been around the block a few times and has a wonderful depth of educational information that he loves to share. I like that about Peter. He's not afraid to show people how he does it. You know, he's not one of those that keeps things away from everyone else. He wants everybody to become better. He's interested in to elevate the entire dental community. But Peter's a worldwide dental educator for technicians, dentists, and auxiliaries. Owner and manager of PZ Dental Studio in Staten Island, New York. He has a personal appreciation and expertise on all phases of clinical, laboratory, traditional, and digital techniques, color communication, and digital photography. He's a board member of the Association of Master Dental Technicians, a teacher educator in the Master Dental Technician program at NYU, faculty member at NYU as well, member of the American Academy of the Aesthetic Dentistry organization, executive board member and fellow of the Northeastern Naphthological Society, editor-in-chief, Inside Dental Technology, and American College of Prosthodontics Technician of the Year in 2018. As you can see, Peter's got a breadth of knowledge, and he is here to share that with us. So, Peter, thank you very much for doing this webinar today. I appreciate all that you give us and the community.
Thank you, sir.
I'm going to turn the screen over to you, Peter, and make you the presenter.
Thank you. I appreciate it. And I think Jim mentioned early on that the topics kind of Jim really comes up with, right? In essence, it's a combination of your questions, all the people that are attending the webinars, and thoughts and processes, and people send, you know, hey, I'd like to hear more about this, and Jim kind of puts that together, and it's kind of fun for me because it kind of challenges me every time he comes up with a topic to figure out what direction to take it and where to go. And this one in the title was staining materials, and he talked about the zirconia materials and staining materials. And I thought, you know, let's kind of focus a little bit to the staining because it's not something that I talk about a lot. And maybe I should, and maybe I shouldn't. Sometimes I'm not really sure. But I will tell you that as I think about it, there was reasons that I didn't focus on it as much as maybe I should have over the years. Although, let's be clear, obviously a large percentage of the restorations that are being done today are monolithic and staining glazed. The reason I didn't focus on it, I'll kind of go through as I go down the list, is because I guess I take a little bit of a different approach on it. So let me start off first by saying, as Jim mentioned, I'm the editor-in-chief of Inside Dental Technology, which is an honor for me. It's been a bunch of years. Maybe I'm not sure how many more years I'll go with it, but it's been there for a while. Recently, I did an editorial called Our Future Dental Leadership, and it was really about the empowerment of a lot of the female technicians out there. And it's funny because I think I got more emails and responses from this editorial than probably anyone I've written in the last 5 years or so. So I thought it was interesting, and I don't know if this spurred this or not, but coincidentally, I was approached by the ladies of the Mill, which is a female group of female lab technicians. If you haven't read the editorial, I'd appreciate it if you read it actually. But long story short, I will be with them for one of their summits, the first ever male introduced speaker into their summit. So it was a very big honor that they asked me, and I'm looking forward to doing that in July, I believe it is. So thanks to the ladies of the Mill for letting me be your first male speaker. And maybe I'm patching the glass ceiling or reverse fixing the glass ceiling. I don't know how you would say that, but it's an honor to do that. So in between a bunch of other dates, I'll be in Dallas, I think next week, and then Montreal, and Italy, and Tennessee, and Mexico, and it goes on and on and on. So I look forward to seeing some people in person, face to face. It's kind of been always a great way to do it, which is what I enjoy the most. So hopefully to see you folks there. I also want to give credit to my team here, and I want to be really clear about that of course I stain restorations. I probably use stains slightly differently than some people do. Although yes, if it's a monolithic restoration, as I go through the process with you today, I'll show you how I think about it. But I also want to be really clear that my team here, Abraham Rodriguez and Helen Young, probably do way more staining than I do, and are probably way better at it, to be honest with you. So a lot of the cases that you may see either came off Helen's bench or some of them come off Abraham's bench, and I think they deserve the credit for that as we go through the process today, because they're a big part of my team and they really help. As far as I usually speak about materials, I think you guys all know that I'm always talking about managing space and how we manage that space, either in full coverage restorations, micro layer restorations, or maybe even monolithic restorations. Our job is really still the same, right? Our clinical partners provide space for us, and our job is to figure out how to fill that space with the right material to make it work, not only functionally, but aesthetically. And I think that's a huge challenge for us, especially when we get into today's world of really more minimally invasive dentistry. And yes, we do monolithic cases too, anterior and posterior, probably still layer a lot in my anterior. And I think we enjoy that kind of maybe separates us a little bit from other laboratories. I think we're extremely busy, and I know a lot of the doctors that call us from around the country are usually saying, I hear you do feldspathic veneers and we'd like to see more layering in our work. And I think it's an area that I've been pushing for our profession for a lot of years to not lose sight of, but maybe a different argument for a different day. So for me, I just wanted to be clear that we do monolithic restorations. I think the challenge out here is that most people think of monolithic restorations, they only think of them really as posterior crowns. And let's be honest, the majority of them are posterior crowns, right? I think more of them are inlay, onlay, full coverage, vonlay, and it really depends on the case. So we're doing lots of those, but also in certain scenarios when we're very minimally reducing the preparation, or for certain functional or even aesthetic needs sometimes, we're very conscious to do the best we can with a monolithic material, whether that's going to be lithium silicate or zirconia. And obviously with the influx of the implants, it makes it even more complicated because you have thicker materials in some areas and thinner materials in other areas. And now your job is to apply the stains and the materials to make them look the same. Very similar to if I'm building up ceramic on an implant restoration or on a full or veneer or full coverage restoration. The goal is still the same, is to make everything harmonize and blend and look natural intraorally. So as I worked my way through that, I wanted to be clear that yes, we do those. I won't lie to you and say it's my favorite. It's definitely not my favorite thing to do, although it's done. And I think in the right scenario, in the right case, I think you can do something monolithic that looks very nice. Also, the process of it is much more improved today, right? Whether I'm milling out lithium disilicate and then simply sintering it and then staining and glazing it, or milling out zirconia, sintering that and staining and glazing it. I have so many options that I could do. And then obviously in this digital world, a lot of these options that we use we'll do even if we're still going into the lithium disilicate world. I know Jim wrote zirconia, but I'm going to cover all the materials. Even with lithium disilicates, we're digitizing a lot of this, and we're utilizing milling wax and then pressing and staining if we're not actually milling with a saprinity or something that's a milled and sintered material. So we kind of follow the same suits over and over again to try to be as digitized as possible, but to also add in the artfulness and the aesthetic values to it. And I think where this really starts to come together is in these larger cases where we're actually working on maybe anterior teeth that we want to do some layering or some micro layering on, and posterior teeth we're going to stay more in that monolithic family. And again, that could be zirconia or lithium disilicate, it doesn't really matter, but the goal is the same. How do I manage the space that I have to work with and make everything work? Well, part of that is in the substructure. How I design my substructures, either through zirconia or lithium disilicate, becomes really critical in helping me to stay in that micro layer world, especially when I'm in the lithium disilicate world, because these cases I'm probably not going to be using any fluorescent materials or marginal materials. I'm just going to micro layer, and maybe if I do use any staining, I'm going to use it right on this substructure here to give me the colorations that I want. So to increase my chroma, increase my value, and then try to create a little translucency, but I'll micro layer that at the end with the internal stain. So sometimes the stains will be inside, sometimes it'll be outside. And this is where I kind of took what Jim said and divided it up for us today. Let's look at it from two perspectives. One, I'm sorry, I'm dragging so much. I just came back from Germany yesterday, so I'm mumbling through my words. There's two real ways to look at this. One, internally, there's a lot we can do with stain, and I use them a lot, probably more internally than I use externally. Externally, the reason I said I don't teach this as much, or I don't feel like it's something that needs to be taught so much, is really because there's not a lot to it. I think the keys that we miss with this is really about understanding and managing the materials. As far as painting the material on a restoration, I don't want to belittle it, but I'm going to say it's not as complicated as maybe we make it, unless you really have not much of an understanding of how the materials work. And that's kind of the way I wanted to dive into it a little bit more. So I think you can see with either micro layered or monolithic, we can kind of make them blend and harmonize together. But let's be clear, the concept is not changing. So for me, and for those of you who watched layering videos and build-up cases that I've shown over the last few years, I've showed this one slide over and over again, where I talk about a natural tooth, and I talk about the chroma in the cervical, the value in the middle third, and that incisal edge position of being, similar to what we want for the age of the patient. Well, it's really no different if I'm staining onto a tooth, is it? I mean, what am I really trying to do? I'm trying to create chroma in that cervical third and probably in the fossa a little bit. I'm going to create a little value in that middle third of the tooth. And the only real change is I probably don't have as much translucency towards the occlusal surface as I have towards the incisal surface. So instead of really working so much on translucency, I'm kind of working on a whitish translucency, where I'll use a whiter stain or even a whiter material if I was layering to get those cusp tips to look a little more natural. But besides for that, it's no different. It's exactly the same concept of chromas, values, and translucencies. Where the other challenge comes in is in the material selection. And this is where I think we kind of skip through this a little more than I would like. Let's be clear. Zirconia, lithium disilicate, feldspathic ceramics, even secondary materials like nanohybrid materials, all of them have different properties when it comes to applying another material to them. So what do I mean by that? If I take a look at zirconia, I'm going to kind of blow this up for you really big. Look at the surface that you see on this zirconia, and think about that surface as you're applying stain to it. And you probably should realize right away that the stain's not going to take, it's not going to be very friendly with this zirconia material, right? What about when I go to the lithium silicate? Again, look at the close-up of the lithium silicates. And you can say, okay, yeah, they maybe look a little bit better than zirconias, but I'm not sure they're stain friendly. And when I get to feldspathic materials, I ground on this a little tiny bit just to clean it off, but I think you can even tell without the grinding, if you just take a clean area, that these materials tend to have a little bit more ability to grab onto our stain materials. So your choice of material for your staining is critical. I get it. Most of us are using either lithium silicate or zirconia. I also use some of the feldspathic materials to do that. The biggest trick that you could probably have with any of the materials that you're using is the word microabrasion. And what I always want you to do is whatever material it is that you're using, I want you to sandblast them. I want those materials roughened on the surface so that anytime you're putting a staining material onto that restoration, it's getting a little bit more bite into the restoration and you're breaking what we call the surface tension of the restoration. Now, the proper word terminology is microabrasion. So let's be clear, but obviously most of us just call it sandblasting. When you're talking to your clinical partners, it should be microabrasion. That's what they do in the office, and technically that's what you're doing every time you open up, put your hand into that machine and use the sand to abrade the surface that you're working on. For us to do that, probably one of the questions I'm going to get at the end of this is how much pressure am I using? And I'm going to tell you that it's usually between 2 and 4 bars, and that's really depending on the material. And I'm using zirconias, I'm going to push those bars up as much as possible, usually about 4.5 pounds, because I'm looking for the most pressure and the most surface breaking of the material. When I go into lithium silicate or even ceramic, I don't need the same amount of pressure. So I'll go a little bit less, maybe 3 bars for lithium silicate. And to be honest with you, I kind of don't have to sandblast feldspathic ceramic. So usually I don't, because the material itself already has a roughened surface, as we would say. The difference between the two is when you look at a restoration that's been not sandblasted, you can kind of see the shine on it. This is zirconia as compared to the one that's been sandblasted. And the bottom line of these two are microabraded. I said is the correct word. The bottom line between these two is that the stains will take much better to the second material, and that's why I always want to do that. Now, when it comes to actually staining a restoration, I guess this is why I kind of shied away from this so often. I'm not sure I could break new ground on how to stain this. I think you all realize at this point in your life that what we're looking to do is exactly what we wanted to do before. I want to create chroma in the cervical. I want to get my value up in that middle third. And then along that occlusal table, I want a little translucency and that little bit of a white calcification and a little bit of color in the fossa. So I don't think there's a crazy amount of teaching to do there, except how do you know which materials will work well and how do you apply the materials differently than what you've been doing before. I think most of you probably heard, I've said over the years that and not my saying, but the definition of insanity is to do the same thing over and over again and expect it to be different. So if you're staining 15 crowns on your desk and you use the same colors and the same brush and the same surface, you're not going to change anything. But if you start to rethink through the process, sometimes it makes it a little bit easier for you to understand the what and wheres of what you're really trying to do. So let's be clear. When we're talking about staining, there's 3 main keys for me. 1, do I want to add fluorescence? And do I want to use my stains to do that? And the answer for me most of the time is almost always yes. I always want to add some sort of fluorescence, and I want to use some sort of a fluorescent type stain. Do I want to add chroma? 100%. I always want to increase chroma, either in cervical areas, lingual areas, or fossa areas, or sometimes even in the incisal region, depending on what the age of the tooth is or what I'm trying to emulate. And then the third one is value. Do I want to increase value, or do I want to not have the value really bounce up for me during when I'm working through the restoration? And in truth, I almost always want to have value shifts in different areas, because It's the transition between, or the contrast, I should say, between value and chroma or fluorescence and non-fluorescence that really gives you more of a natural look in the light reflection. So contrast is kind of king here. I should have wrote that. Contrast is king, right? Also, we have 9 billion colors and choices to choose from. And I know when you guys buy stains, most every company you buy them from says are fluorescent stains, and they call all the stains fluorescent. Bad news is it's kind of not really true. Of course, they put fluorescence in most of the stains when they tell you they're fluorescent, but the challenge is the minute you increase chroma into the stain, so the more color I put in, the more that fluorescence dies down right away. And to be honest, it really should, because I don't want fluorescence everywhere. If I'm increasing chroma, I don't want light reflection, I want light absorption. So to do that, I'm going to raise the chroma or the color saturation, and I'm going to lower the fluorescence in the material, because that's how I'm going to get light absorption. So I want you to kind of keep that in your brain as you're thinking through the processes. And even though every manufacturer tells you that all the stains are fluorescent, it's not true. So if you take a look at my stains in my drawer, and this is actually my staining drawer, basically I keep almost all the stains that I use in my drawer here, and every time I'm ready to stain something, whether it's external or internal, I have everything I need right in front of me, all different colors and shades and values and so forth. Also, what you should notice though when you look at them, notice that these 3 over here, or 4 really over here, have what I would call the highest amount of fluorescence compared to all the others. Now, every one of these bottles say fluorescent stain to them, but yet it's only really these 3 or 4 that have high fluorescence to them. And I can tell you what those are. One of them is an accent stain. One of them is an old school internal, number 1, and the third one is from another company and a different brand. And the reason that I'm pointing out the difference in these 3 is because you'll notice that even though they're fluorescent, even each of them have different amounts of fluorescence to them. And these different amounts of fluorescence are important for me based on how much space I have to fill and what my real goal is in attempting to raise value or not to raise value and add chroma to it. So I want to have different material options to make that work for me. The other big challenge that I think we don't teach enough about staining, this is why I said, and again, I don't mean to sound like I'm mocking staining. I'm not. It's an art to it. And I think, I'd argue Helen and Abe are better at it than I am. And I see a lot of people who are fabulous at it because they do it so often and they have such a nice feel for that artistic approach to painting. For me, I would say that I think the challenge that I see is we're not using the viscosities of the materials well. So if you look at all my stains here in my tray, you'll notice that they all look fairly consistent in their moisture level and their viscosity. But what I don't want to do is take my brush and just dip into it. What I really want to do is if I'm going to use, let's say, an A chroma type stain, I want to usually remix that stain. And I'm going to remix it by adding a little glaze medium and then kind of coming back and changing the viscosity of it. There are times I want it to be thicker and there are times I want it to be thinner. So if you really kind of focus on this from top to bottom as an example, or bottom to top, you'll notice that it gets much more watery here and much thicker here. What's the difference? The difference is if I'm trying to coat my cervical very thin and I just want to add a little bit of warmth, I want that watery viscosity nature. If I want to start going more towards the interproximal and increase the chroma, well, then I'm just going to maybe take a little bit more from the middle third of my material, or maybe even all the way up to the top of that material. But I'm always trying to control the viscosity in the material because that's where you can get the best results from it. Okay, and I think you can kind of see that in most general restorations. These aren't polished yet, by the way. This is just straight out of the glazing furnace. But if I want to get more intense chroma and blend it in, or I want to kind of make it kind of fade away as I go through, I want to get that light cusping tip in there or the deepness of the fossa, I'm really just doing that by controlling the viscosity of the material. And that's what really allows me to give it that nice coat, the combination, I should say, of 2 things. The combination of the viscosity of the material and the surface tension being broken by the sandblasting or microabrasion. I told you I can't speak today. The second thing, or maybe the third, I guess it really is at this point, is I don't only put color into the restoration, especially in monolithic, in my stain bake. a lot of times after I do a stain bake and I come back and I'm getting ready to glaze, I'll reevaluate. Did I get enough chroma? Did I raise the value where I wanted to? Did I maybe not get those white calcifications on the cleft tips that I wanted to? And if that's the case, then rather than restain it or restart over, I'm just going to use my fluorescent glaze paste for that. So if you take a look at these little glaze paste that I have up here, it's all the same glaze paste. But what I'm doing is I'm just putting it out in little small amounts of it. And then I have the ability to say, okay, you know what? I need a little bit more bluish in those corners. So I'm going to take a little bit of my blue stain and I'm going to add a dot of my blue stain to my glaze material. And that allows me to then to have a bluish kind of a glaze that'll help lower the value in some areas. Sometimes I might say, okay, I want to have more chroma. So I'm going to dip into my chroma stain. And that chroma stain that I'm using now, I'm going to basically just add right to my fluorescent glaze. And I could do the exact same thing with the a white color. So let's say the example for me might be that I want something in the white family, or I want to raise my values a little bit. And to do that, I'm just going to add a little bit of a white stain in, right? So I have white stain, chroma stain, and a bluish gray stain. This really allows me to kind of have 3 different colors. And by the way, you can do this with 10 colors if you really wanted to. But in the end, the goal here is really to just utilize those secondary stains or those secondary glazing materials as an example for adding on to the final restoration. Okay, so I'll take those and I'll just mix them up. I'm just mixing them up with my ceramic spatula. And now I have the ability to really just utilize those in my glaze and place them in the areas that I want. And again, where are the areas? Chroma, value, age concept. So the same thing all the way across the board. I'm not changing my concept. I'm just changing the materials that I'm working with and how I'm using it. Okay, and that's kind of what I do for a lot of these cases, a lot of these, even these simple cases. So Jim mentioned Anterior and Zirconia. Here is one, single unit lower incisor. And this is just going to be a stain and glaze case. And I'm going to look at my shading the same way. Where's the chroma? Where's the value? Where's the age? And I'm going to try to make sure that an external stain, I can kind of match what I'm seeing in that patient's tooth. And I think that's a pretty close match for a single unit. Lowers aren't any easier than the uppers, by the way, right? Everybody seems like only the anterior set, the maxillary centrals are the hard ones, but the lowers might be even more complicated because you have less space to work in. So a little bit more challenging. The other times I use external staining is on cases like this, where maybe I'm going to use a feldspathic material. You could obviously do this in lithium to silica too, but not in zirconia, at least not for me. And I'm just going to use my stains as an external on the surface. And how am I doing that? No difference than what I said before. Chroma, value, and effects that I'm looking to create in that incisal third. So there's no tricks, there's no fancy, you have to put the brush this way at this angle. No, paint it the way you're comfortable. Just understand the knowledge of why you're painting, what you're painting there. Why did I take a violet-y stain? Why did I take a blue stain? Why did I take a gray or black stain? Why did I take a B chroma when I'm really working in the A shade range, right? What am I looking for to make that restoration work? Or why do I use a D shade when probably most of you have heard me say I don't really believe in C and D shades yet? If I'm using stains, a lot of times I'm going to a D shade. Why? Because the D shade has a little bit more of a red influence in it, and that's going to help me drop value and raise some chroma. So if I have an area where I want to drop value and raise chroma, I'm going D, even if I'm supposed to be in an A range or a B range. I'm using the material to make the restoration work, not the other way around. The restoration doesn't work because I put the material on it. It's how I utilize that material that's really going to make it work across the board. And again, just for a stain and glaze material, there's a lot you can do, right? I mean, there's a lot of effects you can create, a lot of things that you can really work through that make it really work very well. So that's mostly external. And I know Jim wrote zirconia, so I wanted to be clear that I had some zirconia restorations in here. So that first case I showed you was zirconia. The second one with the lower was also zirconia. This is a single bicuspid, just a monolithic zirconia. Again, preparation, shade information, and then a monolithic zirconia, trying to get it to blend and harmonize. And the same with lithium to silicate. You know, sometimes we choose lithium to silicate instead of zirconia. I don't know if I would go through a real reason of why I would pick one more than the other, except for the functionality of the opposing dentition, right? So I'd rather it not have zirconia if I have a lot of wear on the opposing already, or if it's a functional concern of the case. I know we think that the zirconia is protecting itself, which is true, but it's not necessarily protecting the root, the periodontal ligament, the implant, or the opposing arch, right? So I'm not going to really choose a zirconia as a monolithic restoration unless the opposing is monolithic zirconia too, or it's a functional case that's going to be more zirconia restorations down the line. Otherwise, for me, I'm going to probably want to go lithium to silicate or more layered in the posterior region, okay? In most of the cases, again, besides for zirconia lithium to silicate, I said to you, sometimes they're feldspathic for me. And sometimes that feldspathic nature can just be that I'm going to use something like the Mark II. I call it evolution. It could be the Mark II, where I'm just going to press basically full contour or middle full contour, and then stain and glaze the restoration. And again, I'm just using the stains for the same purposes, although I get a much better stain adaptation in the feldspathic world than I do sometimes in the zirconia and lithium to silicate worlds. And the other thing I wanted to add into this too is anytime I'm staining, I mentioned in the beginning that all the materials are critical. And that's even those hybrid materials. So I think most of you know me as ceramics guy, but I'm a dental technician. I set denture teeth, I colorize my pinks and my dentures and my teeth that I'm using. And the reason I'm doing that is because I want them to look real. And to do that, I don't just take a standard denture tooth. A lot of times when I'm done with a case like this, I'm actually sandblasting the entire case. And then I'm going back with my AKZENT LC stain. So again, staining on the surface and then glazing. And for me, it's very important that the concept stay the same. I'm looking to increase chroma and value and add some depth and coloration throughout the restorations as I go through. So I don't care which staining kit you're using, the concept is really not changing for external. And also in these kind of more involved cases, these materials are actually, for me, a nicer material to use. The example I would give you is when I'm restoring implants that I have no periodontal ligament. I do not want to put a very hard material on the restoration or on the implant. So I'm not looking for 18 million megapascal zirconia there. I'm looking to protect the implant. And for me, a lot of those are going to be enamic type materials, which are nanohybrids, or even layered ceramic on top of it. So if anything, the enamic or the ceramic will wear before I do damage to the implant itself, which is really the goal here. And we can make these look nice with some of the AKZENT LC, right? Just a very simple stain, light cure, glaze, and kind of a simple process. And they look pretty good considering. Will it stay looking good forever? The answer is no. It'll be 1 year to 5 years, depending on the functionality of the patient. And then that restoration can be reglazed or recolored right intraorally, or it even can be redone if the wear factor is getting higher on it. The beauty of it in the digital world is I can basically remill the same restoration, right? Recolorize it, cut it off and replace it. So kind of nice, especially if it's a screw retained implant, because you can actually unscrew it, cut it off, and pop a new one on. So there's some real advantages there with those materials. But the reason I added this into the lecture was because in situations like this, a young girl with ameliogenesis imperfecta, she was 16 at the time. We're not going to restore her teeth. Those are her teeth. They're not prep teeth, by the way. And we're basically going to restore them by using a softer type material and then using an AKZENT LC as an example, just to stain and glaze, like your stain and glaze, and then let her function that way for a few years until she's really old enough to restore. And by the way, this is probably at least a year old, maybe even a little bit longer. So I don't think I actually use the AKZENT LC because it's a newer product. But I use the old AKZENT light cured stains, but the new ones are much nicer, to be honest. So you get the point. Okay, now here's where it gets more challenging for me. Externally, I hope I made it very clear to you how I'm looking at it, viscosity, which materials, when and where to use them. But where I really use stains the most is internally. I like to mix them into my powders. I like to utilize them to create fluorescence on my core structure and then micro layer over them. And I'm really trying to do that because in today's world where I'm doing so many more minimally invasive cases, it really means I don't have a lot of space for anything. So if I have a case where it's a young girl and we're doing a veneer on it, I can tell you I worked with 2, 3, 4/10 of a millimeter for this entire case. So if I wanted to do that with a monolithic material, I need to put all my stains on the outside, which is fine. If I want to do that with a feldspathic material, I might actually be able to put the stains on the inside. I know as I say that, there's probably a few of you saying, well, I do that technique where we press it, but then we come back and cut away the inside and layer some of the stains in there. I'm fine with that technique. I've done it. The challenge with it is you have to have space. You have to have a little bit more space because what I don't want to do is be working in 2, 3/10 of a millimeter and think I can cut away a 1/10 to 2 of a millimeter and put my colorations in there and then refill it. You really need to be more 5, 6, 7/10 of a millimeter to make that work comfortable in my hands. If you can do it smaller, good for you. For me, I tend to say I would rather treat that maybe feldspathically, but utilize my stains more on the internal aspect of the restoration, meaning that if I'm using a refractory dye, I can actually paint my colors right onto the dye and then just put my enamels over that. This way I'm utilizing the most amount of space and translucency without really taking away from the colorations that I'm looking for or the values that I'm looking for. So this was a perfect example of that. I can tell you I did Essential a few times because I really struggled with which material and which ones to use. And at the end, the trick that I found really worked was that I basically painted my colorations right onto the refractory dye and then just put enamels over it. And once I kind of started to go in that direction, it really seemed like it kind of blended much better because the end result was I needed a certain amount of translucency, but I needed those effects to stay on the inside. So this was a great area where utilizing the stain materials internally really helps for me. The other area is when I'm trying to use the materials to maybe mask or fluoresce in areas that you don't normally get fluorescence from your other materials. What do I mean by that? Well, look at this case as a perfect example. You'll notice the young girl, she broke 2 teeth. And we're not going to do anything to those teeth except restore the 2 broken areas. We're not going to prep the teeth. We don't need to do anything more than the damage she has already done. But what I do need to do is figure out how to fill that space. I always joke and say air, right? How do you fill the air? Because there's nothing there. And the truth of it is you can't just fill it with a normal material. Opacious dentin will be too thin in that area and you won't be opacified enough. Obviously, opaque would be too reflective in nature, and that wouldn't help me in that area. Besides that, how would you build opaque in that area? So really, the truth of it is fluorescence. And what am I going to do? I'm going to dip into my stains, and I'm going to mix them into maybe my opacious material or an effect chroma type material, and I'm going to increase the fluorescence of that material. And by increasing that fluorescence, what am I really doing? I'm reflecting the light surface of that tooth. So I can actually make that extremely thin. And because there's fluorescence inside of it, and this is why when I showed you my stain tray, that highly, highly fluorescent material is where I'm going for this. And that's usually the internal number 1. And that's where I'm going to get that little bit of extra fluorescence. And then I can just treat this as a very normal case. And why it's interesting is because when you start to kind of look at it from this perspective, now look inside here. You notice all over here, it's basically just very translucent. But look what you see in here. You can almost see that layer of thickness in there, like a sandwich. And that layer that you're looking at is really where the fluorescence is in the material. And because of that fluorescence, what's happening is now when I put that into onto the tooth, I'm going to get the light to interact very similar that it would to nature. And that's really the goal, is tricking light with the materials that you use. But be clear, when I have the materials on the outside of the restoration, external, all the light reflects from the surface. The absorption doesn't really exist. It's only a false absorption in the sense that it looks like there's more chroma, so it looks like there's more light absorption. But from the inside, I can actually make, or the internal, I can actually allow the light to go in and then reflect or refract in and out. So this is why I always feel like the internal aspect is still the better way, especially in single central world. And again, just honesty. If I'm doing a full mouth case, it's going to be all zirconia or all lithium to silicate, I'm matching each tooth. Not a problem, you're fine. But when you're matching 2 teeth or 4 teeth or even 6 teeth sometimes the transition between the monolithic material and the natural tooth, because of the light absorption, is where the challenges come in. So those are the areas that you have to be extra careful with. This was also an extremely challenging case. Same thing, you can look at the preparation here on the left of your screen, and you can basically see that there's almost none. I have 2/3 of a millimeter or maybe a half a millimeter on the incisal edge. And there's no way you're going to manage that just with materials. So I'm going to utilize some staining materials, maybe a little extra chroma in the cervical third, maybe a little extra gray fluorescent in the middle third, or maybe a little bit extra fluorescent towards the incisal edge to help me get that transition to be similar to what I see in nature. And by the way, I'm also going to do 2 little window veneers on the 7 and 10. And you can see the patient is actually still wearing their ortho brackets. So they're trying to pull their teeth a little closer together, and we're going to be fine with that because I'm really just adding to that incisal third and the incisal third. So as they pull them together, it's only going to wind up looking a little bit better. I'm going to build through my process, and remember I used colors and chromas of stains on the internal, and now I can just go with the normal dentin and translucency and maybe a little bit of mamelon materials. And in the end, I'll finalize my buildup. And I'm going to return this back to the doctor with that little diastamer, but as the patient's wearing their orthodontics, their brackets, their trays, they're going to start pulling those in a little bit more. So I purposely left that little bit of extra space because the goal is to kind of close that in the orthodontic position. And then once I have all the surface texture and all the little details done, I'm going to send those back to the doctor. Now, I think you can imagine those are a nightmare to insert, very, very difficult. And to do that, I'm going to actually give the doctor a kind of a little bit of hand because we're avoiding the brackets that are still there. And I'm going to give the doctor a little bit of a hand by just basically sending everything back to him and making sure that he has a way to grab them. I'm going to give him these little screw buttons, I guess you could say, and glue them on so that he can actually place them in the patient's mouth and then cut them off and polish away the rest of that. So, but again, what really makes that work is the fact that I have internal stains, not the external stain. So it blends, and especially again, it's only really doing 3 teeth, right? 2 and 1, and I got to make them match to the adjacent tooth and the teeth on the side. So it becomes a lot more complicated, and this is where the internal aspect really helps me. And for me, that's kind of the way for everything. That's the way I kind of work my way through it all the time. I'll leave you with one more case, so we have a few minutes for questions. This is actually a case that I haven't finished putting all together yet, but I kind of wanted to squeeze it in because it was a combination of a few things, right? So a young girl, she was in a surfing accident. The surfboard actually popped up and hit her in the face and broke her nose and a few teeth, and she had to have some bone surgery and implants placed, and very, very challenging case. And it also was a doctor that I don't normally work with, so it became a lot more challenging to work with somebody with a different system and thought process. But long story short, the implants were placed, and I'm going to treat this with the zirconia substructure. So you can see that I'm going to do most of the layering where I could. I did have monolithic on the occlusals and the linguals. She had a bite that really allowed well for it, meaning that she didn't have a constricted envelope. She didn't really get much contact with the lingual of the anterior teeth. And then functionally, I just had little cusped tips that stopped into the fosses of the lowers. Everything else is going to be layered. But what I also did here was I just utilized my zirconia and some staining. So I went right to the zirconia itself, and I basically colorized to get a little chroma and a little cervical color and a little value and blue colorish in that incisal third. And then once I did that, because I didn't have a ton of space to work in, now it's easier for me to layer. So I didn't have to add any color stains into the dentins and enamel. I put them right onto my coping. And this allowed me to have the most amount of space to use for the layering process, which was very minimal to start with. For my dentins, which is normal, I fired them just to kind of show. And what I wanted you to kind of see here is you can kind of see the things that I was talking about, right? Look at how adding the chroma stain to the cervical, the value stain in the middle third, and that bluish kind of a stain towards the incisal is giving me all the effects that I really want, even with 1 or 2 dentins. I didn't have to work that hard in my dentin world. After that, I'll cover those up with my enamel materials. It was a really challenging case. I mean, you can see the placement of these implants are really, really challenging. And in the end, we'll finish these up and send them back to the doctor to be cemented and placed and so forth. This was on, I think it was about a week after insertion, if I'm not mistaken. And she actually came to visit me. Like, the question I asked her was, how do you feel when you got the bill for the case? And she wasn't very happy. That's usually when they're most angry. But in truth, she was wonderful. She was a great patient, and she actually just moved to the New York area with her husband. So I'm invited to the house for some strudel. So they're Austrian. So I said, I'm coming over at some point. I want that homemade strudel from you guys. And in the end, the case worked out fairly well. So I hope I explained well Jim's topic. I know I vary from the topics a little bit that Jim gives, but it's my interpretation of how I see them. I definitely wanted to say that I get the staining and glazing concept. I use it. All I want from you guys is to understand the what, wheres, and whys of how you're using it, how to place it, how to create the viscosity, and how to use the fluorescent stains and maybe mix some in at the end. But also don't not use them for the other areas that you really need. And that's the internals, the layering, the increasing chromas or value of fluorescence in areas that you need. And I think if you could put all of those together, I think we'll be a better, across the board, our strength in the technology will be better. What I don't want you to be is just a staining glazer for your whole life. I want you to be more than that. And I think to do that, it's your job to know when to stain, when to internal, when to microlayer, when to fully layer. And I think if you can utilize those aspects, it really makes you more viable as a technician down the road. So with that said, I think we're pretty much right on time. Look at that, Jim, not too bad.
Yeah, no, excellent, Peter. Yeah, you're right. I think a lot of this has to do with the way some technicians are trained today. They're compartmentalized, and they need more of a better picture of the entire process, not just what they do every day. And if they want to branch out, they need to understand more what's going on and how to achieve natural looks and use the materials in a manner that work with the case, with the patient. And that's what you do when you train. So it's fantastic. So thank you very much. All right, so those of you, again, questions with CE, we'll get you a CE. If you registered with your information, it'll be forwarded on to the appropriate CE broker or the CE facility, whether it's NBC or whoever it may be. The workshop was recorded, so if you want to go back and visit, just visit our VITA North America YouTube channel, and they will be on there, as well as several hundred other webinars we've been doing in the last couple of years with Peter and other trainers. So please visit us and learn, continue to learn. If you need to get a hold of one of the local North America VITA sales reps, this is a list that you can look at again when you go back to the VITA YouTube channel and watch the webinar, the recorded one. We have a help desk here as well. If you want to give us a call, we could be happy to help you out. And then come visit us for another webinar. We have a lot of them scheduled for this year with Peter and others. So please visit us again, visit our website, find out what the next program is all about, and come join us. And then Peter has been gracious enough to let us have his information. If you want to contact Peter, Peter is a working technician as well, does a lot of travel. So if you email him or give him a call, he may not get back to you right away. But thank you, Peter, again, for allowing us to share this information for technicians to get a hold of you and maybe ask you specific questions as we go through.
Thank you, Jim.
As far as questions go, so we've got several questions, and one of them is, the question is, does the myo staining wear off after time on facial of anteriors?
So I think All stains have similar challenges, right? What you're normally doing with stain is you're covering the stain with a fluorescent or a glaze material. How thick that glaze material is dependent on how thick you put it on. But usually by the time you fire the glaze, and if you polish or don't, you usually have 2 to 3 microns in glaze, and the standard is teeth wear about 2 to 3 microns per year, depending on the area that you live in. Drier communities are more, moisture communities are less. Point I'm making is you're usually wearing through your glaze, and you're usually on the stains at some point. So yes, you'll wear through the stains, but to be honest, the stains will wear through your other teeth before they wear out themselves.
All right. If you're doing a micro layering on zirconia afterwards, do you do like a skin approach where you put a layer of window on top of it, or is there anything? It's all case by case, right?
No. I think so. If I'm using zirconia, and I've showed this in a bunch of different webinars, I'm sure, and I didn't go into it today, but maybe you saw the one slide that was a 3-unit bridge with a fluorescent kind of a look to it. Usually with zirconia, my first wash bake, as most people call it, or my first bake, is actually either margin material or liner material. And the reason that I'm doing those two is because those are highly fluorescent materials, and those can give me value in chroma or all the things that I need. Now, to be clear, the case I showed at the end, I didn't use the margin materials. I actually used straight stains onto the coping. And that was only because the amount of space was so minimal, but I wanted to get the chroma and the fluorescence as quick as possible. So I guess the simple answer is I'm either using margin, liner, or pure stain, depending on the amount of space that I have to work in.
Okay. And then early on you showed the mixing the blue with the glaze. Do you normally do a one-step process, or do you ever do a stain setup is what the question is?
So almost always I stain first. I'm normally doing a stain bake first, but rather than do a second or a third stain, if I'm really close on that first stain, then I'll just add a little bit of color or chroma or something more in the glaze bake.
And you're right, we did get a question about the air abrasion. So again, I believe you said, you can correct me, but I believe you said it was between 2 and 4 bar. And then what size, aluminous oxide, or do you use glass beads, or?
So I'm using, I think it's 50 micron aluminous oxide, if I'm not mistaken, and I'm using a very pure one. I actually get it from a friend of mine here on the East Coast that it's a very pure. And the reason I say that is because if aluminum oxide says 50 to 150, it means that there are all the particle size in between that number, and you don't know what the percentage is. In other words, I could have 90% at the 150 and 5% at the 50, right? So it's kind of an unfair range of numbers. So you really want to use a very pure aluminum oxide. And I think we use 50 to 100, but I think the percentages that they're like very equally divided up between those numbers. So you're getting a real fair established blast on it. I don't use glass beads. Glass beads are really a kind of a softer material in essence. They're really better for polishing a metal surface, or if you're divesting lithium disilicate because you don't want to disturb the lithium disilicate itself. But as far as the micro abrasion, I really only change it from zirconia to lithium to feldspathic. And like I said earlier, you really almost don't need to use it feldsphathically.
All right. So this person has been getting cases where a shade, like a 1-in-1, but it has a gray bluish translucent layer over it. How would you approach this? I know there's not a lot of detail there, but.
Well, if I understand what you're saying, so in other words, the doctors are asking you for a basic 1-in-1 shade, but when you see the photographs of the tooth, it doesn't, the value looks different. So you see a brightness on the inside, but a more translucent on the outside. And the way I usually approach this, and I actually just did a course on this, where was I? I think was it Chicago or Germany? I usually show three photos of 3 different types of enamel. One would be a very milky enamel, one will be a very translucent enamel, and one will be very transparent enamel. And really, when you're taking your shades, the first things you should really evaluate are those 3 things. What is my enamel surface that I'm working from? Because whatever that is, I might need to rethink what's behind it. So if I want a 1-in-1 and I'm going to be a very translucent bluish gray, transparency on the outside, I'm probably not using 1-in-1 to build it on the inside. I'm probably in a bleaching world. So I guess the point I'm making too is if you need the value of a 1-in-1, but you still want to have that very large amount of translucent kind of transparent effect to it, you're probably not using 1-in-1 internally.
All right. And then we have, do you polish your cases after they're glazed?
Always, yeah. So I used to only pumice polish, and then over years of laziness, I started rubber wheeling and what do you call it, polishing. And I think at this point, I predominantly really just use the polish paints and different ones and different thickness, different viscosities. The few different ones I use with different rag wheels and different avid brushes, but I guess I got too lazy to go up and walk into the back room for the pumice machine every day.
And then for micro layering, do you ever use the opals? And if you do, where do you place them?
So I do. I'm a big fan of opals. You have to be a little cautious with opals because, how do I say this quickly? I think here's what I would say. In ceramics, we can't really make opals. We make something that's similar to what optics of opals can do. And to do that, we use opacified particles in different thicknesses and sizes to reflect and absorb light differently. With that said, as you know, the more I fire ceramic, the more you break down the internal structures of the material. So the more opacified pieces become smaller, the more glass-like structure it becomes more involved. So the point I'm going to make to you is I love opals, but I'm cautious to use them in certain thicknesses and where I use them, which is mostly around that outer corner of the area, around the tooth, and maybe every once in a while a band of an opal somewhere through it. But I tend to use those in my first bake only if I'm doing the whole crown in one bake, or if I'm doing 2 bakes, I usually like to put the opals in the second bake. This way I'm not devitrifying the material by overfiring it too much.
All right. And then wrapping it up, for lithium disilicate, you know what temperature you usually run your stained glaze cycle at, the high temperature?
Yeah, I think you know, it's funny because sometimes I go really low, like 720 for set stain, and I can go that low because I'm only just doing it to freeze it onto the core, right? But if I'm glazing it, I'd like to be kind of in the 740, 750 kind of range because I find that the glazed pastes work best somewhat in that range. Sometimes you can even push it to 760 or 770. If you're not putting any ceramic on it, I've gone as high as 780 or 790. But if I'm for a final glaze, but if it's just for set stain, 740 to 750, you're fine. 720 to 750, you're fine.
All right. Well, thank you very much, Peter, for taking the time out of your busy day and schedule, just getting back from your trip. I'm sure you're tired, so I greatly appreciate it.
How tired those eyes look there, Jim?
So,
flight day.
So, any parting words for the group that's online? Any last-minute thoughts?
Thank you guys for attending. I hope I put together Jim's challenge. I think Jim kind of comes up with titles. He sits home and goes, "Let's see what Peter's going to do for this one." He wants to make them harder sometimes, and it's kind of fun. So I hope it's like a testosterone battle between Jim and I to figure out what he wants me to say and what I want to say. But no, thank you for picking him. Thank you for all your suggestions. Thank you for all your kind words. And I hope to see a few of you in person in the next few events that I'm at. And thank you guys for popping in.
And I believe Peter will be at the DLAT, I believe, the Dental Lab Association of Texas, in a month or two. Or
next week. It's like 2 weeks. 2 weeks from now.
Yeah, maybe it's in April. So hopefully everyone will see you there. And I want to thank everybody for joining today. It's been an excellent webinar, as always, with Peter. Great wealth of knowledge. Loves to share it with everyone. I hope someone picked up some pearl of wisdom from Peter. The information is on the screen if you want to get a hold of Peter. And I will thank everybody again. And this will conclude today's webinar with Peter Peasy. Thank you for joining us.
Take care, everybody. Bye-bye.